Good morning, everyone. Bonjour tout le monde. Ani. My name is France Gélinas. I'm the MPP for Nickel Belt and the health critic for my party, the NDP. We are here today to shine a light on the health human resource issue in cardiac testing. Let's make it clear. A heart problem is something that you should go to your healthcare provider and you should have investigated in order to get a diagnosis and a path to treatment. Most diagnoses are based on the result of cardiac testing done by cardiology technologists, such as electrocardiogram, stress test, Holter monitor, echocardiogram, pacemaker and defibrillator testing, and many more are done by the good people that are standing here with me. I'm happy to say that in most hospitals in Ontario, certification by the Ontario Society of Cardiology Technologists is the standard. Not mandatory, but it is the standard. But in the private sector, it is not. We all know that this government is expanding private for-profit delivery of our healthcare system, where they tend to hire the cheapest employee they can find in order to maximize profit, and it is absolutely legal in Ontario to do that. We are here today to protect quality cardiac care and ask that Ontario follows other provinces in mandating certification of cardiology technologists in order to protect patients as well as maintain quality care. It is now my pleasure to introduce the president of the Ontario Society of Cardiology Technologists, and this is Blair Arnold. Blair, come on up.
Thank you, France. So as Ms. Gélinas said, my name is Blair Arnold. I am the president for the Ontario Society of Cardiology Technologists. And we have been on a quest for over 20 years asking the government to standardize our practice in Ontario. We want every Ontarian, whether they are getting care in Toronto, Sudbury, or London, to have the same care and get the same qualified individual performing and interpreting their tests to make sure that they get the appropriate care at the appropriate time. We have seen many, many mistakes that have harmed and sometimes resulted in significant tragedy for our patients. And we want every Ontarian to feel comforted that they are getting quality care, regardless of whether they're going to a major city hospital or a small private clinic. We all have stories, unfortunately, and they're all getting more and more frequent as our population ages, and even post-COVID. We're seeing more and more cardiac diseases and younger patients. I'm going to turn over the mic to my colleague, John French, to share with us such a story of patient harm.
Good morning. Thank you, Blair. I've been a registered cardiac technologist in Ontario for a little over 20 years now, and as Blair alluded to, I have seen quite a number of miscalculations, errors, downright tragedies, I guess it is the best word to describe it, regarding patient care based on the knowledge that I acquired through Mohawk College. I've been asked to relate one of them today. We had a patient present to us for a treadmill test from the emergency department. The individual had come into the department having chest discomfort. While they were being prepped, I managed to draw the straw on that one. I set him up for the treadmill testing, and while I was doing this, I noticed that the digits on his fingers on his right hand from the knuckle down were basically chalk white. This was not something normal for anybody, let alone a cardiac test patient. So I alerted the cardiologist who was supervising the testing that day. The doctor came in and talked to the patient, listened to his chest, and identified a heart murmur. Putting the patient with a heart murmur on a treadmill is not the best thing to do. Occasionally it's a requirement. But the doctor changed the testing to an ultrasound of his heart, an echocardiogram. When the patient was undergoing the echocardiogram, he suffered something called an aortic dissection. This is a condition where the main blood vessel pumping out of the heart basically unravels from the inside, blocking any blood flow. So he ended up code bluing, which means his heart stopped. He was not in good shape. The code team that responded eventually ended up with one of the lead cardiac surgeons in our hospital. And this physician cut the patient's ribs open, stuck his arm inside the patient's chest, and started doing cardiac massage while he was riding the gurney up to the OR. This condition is essentially lethal unless it's captured very, very quickly. And the response by the team in the hospital was within minutes of something occurring. Now, the fact that I was able to identify a condition in this patient that may or may not have affected the testing was because of the training and the standardization that I'd received through the cardiovascular technician program at Mohawk College. There are several other programs in the province that offer this training, but if you were in a non-clinical situation like the hospital in a privatized area, this may or may not have caused the patient to suffer a lethal action while they were there. It's very important that we have everybody that's doing the testing that we are performing daily understand what we're doing and standardizing how we treat it. It's very important for the healthcare of the people in the province, and also in the long term, if the test is ordered incorrectly, there's a substantial cost to reproduce the testing and to diversify into other types of testing. So limiting the cost and limiting the loss of life because of the lack of standardization is something that we need to address immediately in the province. Thank you.
Good morning. My name is Regine de Verk, and I'm a registered cardiology technologist. I also am a professor at Mohawk College in Hamilton, Ontario. And we are calling for the standardization of ECG-based diagnostic testing to improve quality of care for patients, so in order to provide safe, quality patient care. Inaccurate ECG-based testing puts the patient at risk of harm. There are many errors that can happen in technique. And if lead placement is inaccurate, it can lead to misdiagnosis. It could lead to a missed event or mimic events that aren't actually present. So it's really important to have a standardized process for all our patients across Ontario. And in this day and age, we have skilled technologists who have graduated from an accredited cardiology technology program. Since the late 90s, we've had cardiology technology programs across Ontario. So we're calling for a standardized process here for hiring and for the conduction of these, the performance of these tests. Because these graduates, they've met the competencies required of the profession, and they have the knowledge, skills, and abilities to provide accurate ECG diagnostic testing and provide safe patient care. Thank you.
Hi there, I'm Karen Rondinelli, and I've been in cardiology as a registered cardiology technologist for over 30 years, so I think I'm the oldest one here. With saying that, I've seen an awful lot of things happen over the years. So when you do have an order from your doctor to have a cardiogram done, ECG, it's the very basic test that everybody normally gets. Ask the person that's doing the test, are you qualified to do it? Or even just say, did you get training? Find out what they've actually done. It's so important where they are placing the electrodes on your chest. A couple of millimeters off can basically give you a misdiagnosis on your cardiogram. So it's your life, it's your heart. I've got lots of stories, but I could be here for hours saying it. So it's basically just take care wherever you're getting the test done and ask the question, are you trained? Do you know what you're doing? And you may think, well, I'm not the one that should be saying it. It is your heart, and this is what you need to be asking. You want good quality care. And that's all I have to say.
Good morning. My name is Ashley, and I'm a cardiology patient. I'm honored to be here today to help with the OSCT and speak of the importance of cardiac safety. When I was 16 years old, I began fainting, and my parents took me to a basic medical clinic. No actual testing was done, and they told my parents I had low iron. Over the years, I was diagnosed with an arrhythmia, specifically a prolonged QT. And participating in research programs, we discovered it was actually genetic. So I then took it upon myself to get my children genetically tested. My daughter was also diagnosed with it as well, and early detection has allowed us to take steps to make sure that she's safe in everything that she does. This experience taught me how vital it is to listen to your body. Symptoms like dizziness, fainting, chest pains, they're not inconveniences. It's your body telling you something is wrong. So that's why I'm here today. Cardiac care is not something to take lightly. Your heart is a vital organ, and everybody should be trained properly if you're providing care on that organ. So today I joined the OSCT in calling on the government to take action. We need proper training in the healthcare.
My name's Katie Spratt, and I'm a registered cardiology technologist. I just want to highlight from Ashley's story the importance of her going finally to have cardiac testing. She mentioned that she was starting to faint and these symptoms were being ignored. Without having an ECG done and then appropriate Holter monitoring, which is a monitor that you take home to watch your heart while you're doing your daily activities, her arrhythmia may never have been discovered, which could have led to her continuing to faint, continuing to go into those dangerous rhythms, and someone who is untrained would never have known either to give her those testings, to set those testings up correctly so that that dangerous arrhythmia could have been detected, and then she could enroll in that program to help the doctors then continue to study the rhythm and learn what's dangerous about it, and also get her daughter tested so that those risk factors could be minimized. Recently, I did conduct a survey with our membership, and it's important to note that we have approximately 1,200 members in the Ontario Society of Cardiology Technologists. Approximately 58%, or a majority of them, reported that they have seen dangerous things happen to patients from unqualified individuals performing these tests. We only have one heart, and knowing how to properly interpret and even set up those tests for the patients can be vital and lead to further complications that could very easily be avoided. So it all comes down to ensuring that the people are properly trained, getting that standardization out there to try and create more success stories like Ashley's and less like the stories that some of my colleagues here have shared. Thank you.
Hi, my name's Katie, and I am a registered cardiology tech and have been for the past 15 plus years now. A proud graduate of Mohawk College. There are many other worthy colleges throughout the province. In my job as a clinical applications specialist, where I trained techs like myself to use equipment that they purchased from our company, I was always so relieved to find a tech who had graduated, of course, foremost from Mohawk College, but from an accredited college where I know they are trained properly. I was so relieved to know that those physicians who purchased that equipment could have quality testing provided by the techs that I trained on the equipment that they purchased, and I left knowing that patient care would be top-notch. Thank you.
So I'd like to, at this point, thank both Ms. France Gélinas and also nod to our wonderful lobbyists at SWAN, Kirsten Kroos, and to my esteemed colleagues that are here with me today to implore the government to hear our stories and realize that 1 in 12 Ontarians will experience cardiac disease in their lifetime. And we don't get to choose when or how that happens, but we do get to choose if you get the right care at the right time by the right personnel. And I just want to thank everyone for hearing our message today.
Thank you, everyone. We're open to questions.
So you guys are calling into question the qualifications of some of people who are doing medical. Where are these people working? Like, why would they be cardiac technologists if they are not trained to be cardiac technologists? Like, who are these people that you are concerned about? Where are they, and how many of them are there?
As you heard, there are many, mainly physician-led practices where you can have cardiac technology, cardiac test done. Right now, there are no standardization in Ontario. Those clinics can hire whoever they want. They are the one who will show them how to use an ECG, how to use an echocardiogram, how to place a Holter monitor. When we have accredited program in colleges in Ontario that teach people how to do this, they go to college for years to make sure that they have the knowledge, the skills to do this safely. But as opposed to many other health professions, this profession is not regulated. It is not mandated that they are registered with the Ontario Society of Cardiology Technologists or anything like this. So you could, if you want, apply to the private clinic. We would teach you how to do an ECG, and I will leave it up to you to. We know that the quality of care and the safety of care is a whole lot higher when you have a certified cardiology technologist doing the test. They will pick up things that their training allow them to pick up. When we're talking about heart, we're talking about heart disease, little differences, picking up a little change may be the difference between an accurate diagnosis and a non-accurate diagnosis, which leads to the right or the wrong treatment and continue. And it happens in Ontario. Other provinces, like Quebec, just next door to us, have mandated that anybody who will do an ECG, they have to be a member in good standing of the equivalent to the Ontario Society of Cardiology Technologists. The Canadian Society, anyway, in Quebec, they have the equivalent to what we have in Ontario, and not only for their hospital base, but also for their private clinics. We want Ontarians to feel safe that no matter where you go for your testing, it will be a qualified cardiology technologist who will do your test.
So we're talking specifically about the diagnostic clinics authorized by the Your Health Act? Or are we talking about more generally? Are we thinking about like a place like Life Labs or another diagnostic? Is this are we directly pinning this on like the Bill 60 stuff?
Some of it with Bill 60. We expect more of it, but it already exists in the clinics that exist right now, that non-qualified people are doing the testing.
Okay. So to standardize something like this, does that require the creation of a regulatory college?
We have the Ontario Society of Cardiology Technologists who could become a college. They could join an existing college, the College of there's many of them that they could join. You wouldn't have to set up a new college. You could have them be part of sonograph and x-ray techs and many others where would have the knowledge to bring them in, or simply make the Ontario Society of Cardiology Technologists. Did you want to say more about that?
I can definitely comment on that. Yeah. So with regards to joining a regulatory college, there are several colleges that we could join up that do match up with our scope of practice. In fact, there's one college where we share common members. So it would be a very seamless transition into that. The cost to the government would be zero. We're looking at if they standardize and we become a member of that college, and we have all these set up in place, such as we have continuing education that has to be adhered to. We have due payments that have to be done annually, and members have to stay in good standing. So we have that all set up. And quite honestly, if we were to become standardized, we would in fact be saving the government upwards of $40 million a year.
Which college would you be considering joining?
We have approached several. The one that we feel would be most appropriate is CMRITO, as we do share a lot of common members, such as echocardiographers. In fact, my colleague Karen here is an echocardiographer. So that would be ideal if we could join up with their college.
How's the discussions with these other colleges gone so far? Are they interested in seeing that happen?
So far, we are in contact with them, and we're hoping for a favorable conversation in the future.
Have you talked to Sylvia Jones about this yet?
We're hoping to.
Did you have something today, or you have asked for a meeting? Has she indicated that they'll give you a meeting? Are they ignoring you? Ooh, what's happening?
I think Sylvia Jones is just has a lot on her plate right now, and she would love to meet with us, but I think our schedules are not lining up.
I guess, what happens to the people who have these jobs right now if it is standardized? Do they have to go back and train, or would they lose their jobs?
Oh, absolutely not. We're not here to take jobs. The healthcare system can't afford to lose a single one of us. In fact, my department, I am expecting to call me any moment and say, "Can you come in?" So no, we don't want to take jobs. We just want to bring everybody up to the same level. And if that is, if training is required, we are well situated to provide free or low cost training, and a standard exam, which is, again, very low cost. So we are not here to take your job if you're already doing this. We just want to make sure that when you provide this care, it is appropriate.
I think I'm good.
Okay, thank you.
Did we have online?
No callers.
No callers? Okay. Thank you very much. Merci beaucoup. Chémiwech.